You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Inam-Ul Haq. Dr. Haq is a board-certified general and vascular surgeon. Dr. Haq has been performing vascular surgery for the past 30 years. We've invited him on the program today to discuss advances in the removal of unsightly veins on the legs, hands, and face. Dr. Haq, welcome to the program.
Thank you. My pleasure.
Now, before we get into today's topic, in New York, you have one of the biggest vein centers out there. Tell us a little bit about your practice.
Randy, I'm a vascular surgeon, and I have been involved in practice of vascular surgery in Brooklyn for the last 35 years. During that time, I have been treating both arterial and venous disorders.
Okay.
But over the last 15 years, my practice has shifted to exclusively treatment of veins and venous disorders.
So it's all you do there?
That's all we do.
You teach the topic as well, is that right?
Yes, we do. Actually, we have physicians from all over the country who come to our office for training and for.
Oh, is that right? So it's a training center as well?
It's basically a training center. Last week we had a physician who came from Bosnia. I don't know how.
From Bosnia?
From Bosnia to learn this technique. She told me that there is nobody over there who is doing this kind of work, and she was very excited.
Okay. Now, you're also an assistant professor at Mount Sinai. What is your role there?
Yes, I am. I am an assistant professor in surgery at Mount Sinai School of Medicine. The residents from Mount Sinai School of Medicine come to Maimonides Hospital, which is a very prestigious hospital in Brooklyn, where I practice, and I teach them about surgery and about vascular disorders.
So no matter how big or small, you could take care of it.
That's correct. As I was saying, it can vary from those spider veins to those big bulging veins that cause swelling and achiness in the leg. And when the problems really get bad, you get patients who have complications from these varicose veins. And they include phlebitis, a formation of blood clots, leg ulcers that become very painful and very difficult to treat, and constant swelling, and we treat those patients too. So we treat, in the vein center, a whole spectrum of venous disorders.
All right, now anticipating this interview, and we're here at the CBS station here in California. I guess here in California, an RN can do it. Any physician, medical doctor licensed can do it. Who should people look to get that procedure?
Well, you have brought about a very, very important point, Randy. Because the venous procedures have become well known, every physician and every healthcare professional is trying to do it, I guess, to add revenues to their practice.
Well, they have come to me, by the way, and, that want to get on the show, and I say, is this all you do? And they say no.
But this is one of the reasons for me to come to your show. To inform the people and the public as to what kind of physician they should look for if they want the right kind of care for their vein problem.
The vascular surgeon seems like the natural guy to go to.
Well,
and this is your specialty.
The vascular surgeon, by his education and training, is the person who takes care of venous disorders and who is familiar with the different complications and the problems that can happen from varicose.
Does it frustrate you that any medical doctor can do this? And the public, I guess, doesn't know?
It is very frustrating because the patients get suboptimal care.
When you say suboptimal, what do you mean?
Well, suboptimal means that the patient will come and have the treatment done, but the problem that the patient is having may not be properly addressed. The patient may have temporary relief of her spider veins, but the spider veins will come back.
They can come back.
They can come back because the root of the problem has not been properly diagnosed.
And that happens?
Treated.
That happens?
It happens very, very frequently. We actually have patients in our office who say that they had their veins closed or veins stripped, and they come back. We do an ultrasound examination, and lo and behold, the saphenous incompetent vein is still there. And it's no surprise that after a year or two, they are back to the same problem where they started from. So it's a wastage of time and money.
So there's a lot of technique involved? Is this?
There is a lot of training and there is a lot of precision that is involved in carrying out these techniques.
Tedious work?
It can be tedious work for somebody who does not really know.
Okay.
For somebody who is properly educated and who does on a daily basis, it becomes very gratifying work.
Why do you like doing it? Because I've talked to doctors. They say, well, that is tedious work.
Well, I like doing it because, one, you can do it in your own office. You can do it on an ambulatory basis.
Okay.
You can provide relief to the patient for a problem for which she has been seeking treatment for a long time.
So a happy group of patients.
A happy group of patients. It is very gratifying to see a patient come back after the procedure. They're happy, their life has changed in the sense that previously they were not able to go out and enjoy themselves in public.
You say they, some of your patients say that they haven't worn shorts in 20 years or a skirt because of their vein problem.
That is correct. When I started vein practice, I was really surprised as to how self-conscious women become because of these spider veins. They become introverted. They will not go out in public with bare legs. They will not like to go on the beach and expose the varicose veins, because to them it seems like an insecurity that they are trying to constantly hide.
Yeah, because I looked at your photos, and by the way, if you're just tuning in, these photos are dramatic, these before and afters, and you're saying without surgery. But I don't see legs like this. I don't see these veiny legs.
Well, the varicose veins are very common, Randy. You don't see them because you don't see patients.
They're hiding them, you're saying?
They're hiding them. Most of the patients who have these problems would rather not expose their legs in public.
For varicose veins, the stripping method, which requires a hospital stay, and we've talked on the telephone, you say that possibly is a thing of the past. But it's still being done today.
It's still being done. And it brings me back to the same point. The proper training and awareness, even among physicians and healthcare professionals, is really lacking.
So those big bulgy veins, you're saying you don't need to do a stripping procedure?
Absolutely not.
Really?
Absolutely not. Over the last 10 years, when we started doing this laser closure.
So laser closure.
Laser closure, it's one of the methods, and we will talk about it. I have not done vein stripping. Now, I'm a vascular surgeon by training, so before that, we used to do vein stripping, and that involved taking the patient to the hospital, general anesthesia.
It's still being done today. Now, why?
It is still being done because, as I said, most of the physicians are just following the old techniques. They have not bothered to learn the new procedures. And
does insurance cover these new procedures?
Insurance covers most of these varicose vein problems.
Okay.
If you have symptoms like swelling in the leg, which most people have, or achiness, or tiredness, or pain, any of these symptoms, then it's a medical problem, and the insurance will cover it. If it is purely cosmetic, they may not. But the vast majority of patients are covered by insurance.
So what are the different methods or approaches to vein elimination?
Randy, there are different approaches available to treat varicose veins, and certainly one treatment doesn't suit every patient.
Okay.
There is the old-fashioned vein stripping that is hardly necessary for any patient. Then there is the newest technique, which is thermal ablation or closure of the ballooned out or incompetent vein.
That's a laser.
That's the laser.
Okay.
And then there is the sclerotherapy, or the injection method.
Just inject the vein?
Just inject the vein, and that generally is more suited for those fine spider veins that are more or less a cosmetic problem.
Okay.
And those three modalities are the ones that are available.
But don't you need those veins? The part I don't quite get is are you collapsing? Are you removing, dissolving the vein? And also, don't you need those veins? And how do you live without them?
No, Randy, what happens is that you have thousands of normal veins in the leg. It's just that one vein that runs from the groin down to the leg, called the saphenous vein, which has the tendency to balloon out and stretch in some people, so that the blood, instead of flowing back to the heart, backs up in the leg. That backing up or leaking of the blood into the leg over years then causes bulging of the branches of that vein. And that's what you see as spider veins, varicose veins, those big bulging veins. And those veins are redundant.
You don't need them.
You don't need them. They're interfering with the circulation. They are not letting the blood flow briskly back to the heart as it should. So eliminating those veins restores your venous circulation.
So what's
back to
causing the
normal.
pain? You say that they're painful.
The pain is one, stretching of the vein because of the leaking of blood into the leg when you stand. That stretching of the vein hurts. The blood stagnating in the leg can cause inflammation and irritation of the skin and the tissues in the leg. That can become very painful. As you know, the blood, when it keeps flowing, remains fluid. If it becomes stagnant, it tends to clot. And that's what happens in some of these patients with varicose veins. These bulging veins make the blood stagnate.